So I was diagnosed with depression when I was 11, and that was because I had a sense of abandonment from my father. I grew up with my mom constantly working, and it was very hard for me to see her, and it was like I didn't have an emotional connection, and I just felt like I wasn't loved. My mom was open to getting me help, but it was very hard for me to ask for it because it was like I didn't want that judgment from her, and she didn't give it to me, but I always felt like I had it.
Our mission is really to provide culturally competent support services to people in a holistic way. And that's just the one sentence we always use. But I always tell people that because all of our staff are bilingual and bicultural, we're also creating family. I mean, it's in the name. We grew from just having community support, substance abuse, mental health, and domestic violence support. And now we provide mental health services very, very broadly, so we focus on anyone at any age, and they're all no-cost services. We also provide community support services, which can be something as maybe small as filing Medicaid applications to as big as access to vaccinations, signing up to vote, giving workshops on English as a second language or citizenship classes. And in our survivor programs, we do anything from emotional support to advocacy at the legal level, to helping them file for divorce, to helping them seek safety after experiencing harm. So we are kind of a one-stop shop, and we work really well with community partners. So I'm very grateful that we have community partners who also see the value of the work that we do. So this year, Sani is one of our youth leaders, and so we've gotten to see them from camper last year to now kind of taking on these leadership roles. They're a perfect example of how mental health and garden work, outdoor work, work hand in hand.
So I was like, oh, this sounds amazing. And then they also told me that they were doing a mural at the time. So I was like, okay, two things I really like, being outside and art. So I was drawn to it, and that's how I started. Last year I was in a really bad place with the pandemic and everything, having to go to summer school, and being in that summer youth employment program just kind of helped me crack out of that shell that I was stuck in. And so I was like, that was such a great environment that I want to come back again and experience it all over. When we're outside, we have to like constantly, you know, pick out the weeds or something like that, and you're thinking about something, and you're thinking, like, I know for a fact that I was like reflecting on like, oh, like, this is me doing something great every day, like trying to help myself get out of bed, things like that. And I know for other people it was like being there every day was something that helped them, like it was like an extended support outside of their own houses. It was like, we're here, we're making an impact, and we're together, and we're creating a connection, a bond even. I definitely know that there's a lot of resources that I've personally seen that have kind of been like, if you need help, we're here for you. And especially that summer youth employment program, if you need to kind of just get a new environment, the summer youth employment program is like the right place for you.
Blue Cross Blue Shield of Michigan is delighted to support El Centro, which is also known as the Multicultural Family Center in Pontiac, Michigan. We support this program through our Strengthening the Safety Net grant program, and we support up to 50 other clinics like this throughout the state of Michigan. So we're especially delighted about this partnership with this organization because they provide a very unique and valuable service, which is free behavioral health care or low-cost behavioral health care for those with insurance. And they offer this service bilingually, Spanish and English, to anyone who needs it.